Welcome to Bio 1160 Lab 2 on the skeleton. Any questions about the lab should be directed towards your lab instructor or your course instructor. All instructors have the email firstname.lastname@lethbridgecollege.ca.
Today's section will begin with the vertebrae. The vertebral column contains 33 to 34 bones in infants and 26 bones in adults. They are grouped into 5 categories: 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 sacral, and 4 or 5 coccygeal vertebrae. Before discussing individual vertebrae, we should discuss vertebral structures. The vertebral foramen is the large hole seen here in the center of the vertebrae, which the spinal cord moves down. The body of the vertebrae is the large portion of the vertebrae that faces the anterior. The transverse process is the process that is most lateral on the vertebral structures, shown here by the orange arrow. The spinous process are the bumps you can feel down the center of your back and are at the most posterior section of the vertebrae. The lamina make a portion of the neural arch. The pedicle are little feet that attach the lamina and other structures to the body of the vertebrae. The inferior articulating process allow the vertebrae above to articulate with the vertebrae below. On the opposite side, the superior articulating processes allow the vertebrae below to articulate with the vertebrae above. In between vertebrae, you find the intervertebral foramen, which allow the passageway of the spinal nerves. We'll begin our discussion of individual vertebrae starting right at the top with the atlas, or C1. The atlas vertebrae is distinguished by the lack of a body and the lack of a spinous process. The superior articulating facets of the atlas articulate with the occipital condyles of the skull. The axis vertebrae, or C2, is distinguished by a large tooth-like structure that sticks out the superior surface. The odontoid process, or dens, shown here with the orange arrow, allows you to move your head from side to side. A typical cervical vertebrae, or C3 through C6, should appear to be smiling at you. They are distinguishable by the bifid spinous process towards the posterior side and the transverse foramen, which allow passageway of the vertebral artery. C7, or the vertebral promenade, differs from other cervical vertebrae in that it has an elongated, singular spinous process. Thoracic vertebrae are a little bit bigger than cervical vertebrae. They are distinguished by an elongated, downward pointing spinous process, and elongated transverse processes meant for articulation with the tubercle of the rib. Lumbar vertebrae are characterized by sheer size. They are the largest of the individual vertebrae. They have an extremely large body, as shown here with the orange arrow, and a parallel pointing blunt spinous process. The sacrum is composed of 5 fused vertebrae. The sacral foramen allow for the passageway of the sacral nerves. At the bottom of the vertebral column, we will find the coccyx, or the tailbone as it's commonly called. It is composed of 4 or 5 fused vertebrae. We will start our discussion of the ribs just with some general rib structures. The head of the rib articulates with the body of the thoracic vertebrae. Every head sits on a neck. Just below the head, you will find the neck of the rib. The tubercle of the rib, as shown here with the orange arrow, articulates with the transverse process of the thoracic vertebrae. The rest of the rib is considered to be the shaft of the rib. There are 12 pairs of ribs. They are grouped into 3 distinct sections. The true ribs attach by the costal cartilage directly to the sternum. The 3 pairs of false ribs attach first through costal cartilage to the costal cartilage of rib number 7, and then to the sternum. The floating ribs articulate with the vertebrae at the back, but do not attach to anything anteriorly and are therefore considered floating. The sternum is found in the superior portion of the thoracic cavity, directly down the midline of the body. It is commonly called the breastbone. On the superior surface of the sternum, we find the suprasternal notch, sometimes called the jugular notch. The manubrium makes up the majority of the superior surface of the sternum. The sternal angle is the joint between the manubrium of the sternum and the body of the sternum. The body of the sternum is shown here with the orange arrow. At the base of the body of the sternum, we find the xiphoid process. The xiphoid process serves as a muscle attachment for the diaphragm. Shown here in orange is the clavicle, or your collarbone. It is the most commonly broken bone in the body. There are 2 basic structures you need to know for the clavicle: the sternal end, which articulates with the sternum, and the acromial end, which articulates with the acromion process of your scapula. The scapula, or shoulder blade, are a pair of bilateral bones found on the posterior section of your thoracic cage which articulate with the humerus. The bump you feel towards your shoulder is your acromion process. The acromion process serves as a muscle attachment for muscles like the trapezius. Shown here with the orange arrow is the superior angle of your scapula. Opposite to the superior angle is the inferior angle of the scapula, shown here with the orange arrow at the base of your scapula. Attached to the acromion process, we find the spine of the scapula, which is also a large muscle attachment. On the lateral portion of the scapula, we find the lateral border. And on the medial portion, the medial border, where the rhomboid muscles insert. Underneath the scapular spine, we find the infraspinous fossa, the place where the infraspinatus originates. And above the spine, we find the supraspinous fossa. Similarly, the supraspinatus originates here. Shown here in the orange arrow, from looking at the lateral portion of the scapula, is the coracoid process. It is a large insertion site for the biceps muscle. The glenoid fossa is just inferior to the coracoid process and articulates with the head of the humerus. The scapular notch is found on the superior portion of the scapula, just medial to the acromion process. We will now begin our discussion of the humerus. The humerus is the proximal bone in your arm and articulates at the glenoid fossa of the scapula. It articulates with the radius and the ulna at the distal section. At the top of the humerus you will find the head. This is the portion that articulates with the glenoid fossa. The greater tuberosity is on the lateral side of the humerus and is an insertion site for many of the rotator cuff muscles. The lesser tuberosity is more medial and is the insertion site for the subscapularis muscle. In between the two tuberosities, you have the intertubercular groove. Surrounding the head of the humerus is the anatomical neck. And more distal down the humerus is the surgical neck, the area where most surgeries happen. Down the lateral portion of the humerus, you'll find the deltoid tuberosity, the insertion site of the deltoid muscle. Looking at the distal portion of the humerus, we find the medial epicondyle. The medial epicondyle is the origin of the flexors of the wrist. On the lateral side, there is the lateral epicondyle. The lateral epicondyle is the origin of the wrist extensors. The globe-like structure on the lateral portion of the humerus is the capitulum. It is the articulation site of the head of the radius. And medial to the capitulum, we have the trochlea. The trochlea is where the ulna articulates with the humerus. The coronoid fossa is above the trochlea. It is where the coronoid process of the ulna moves towards the humerus. On the lateral side, you have the radial fossa. The radial fossa is the place that the head of the radius moves into. The olecranon fossa is found on the posterior side of the humerus. It is the place where the olecranon process